Hi, everybody. This is episode 2 of Ask the Doc. Got a really good question from John on Facebook. He said, I went to my primary care doctor last month when my back went out. How come I feel like he was completely lost about what was going on and it seemed like I knew more than he did? This is a really good question. So in this video, we kind of want to go over the pitfalls of what happens when you go to your primary care doctor for a musculoskeletal injury, shoulder pain, neck pain, knee pain, low back pain, or even going to the emergency room. So I've said it before and I'll say it again. The current medical model is a complete disaster. Insurance companies have ruined everything. They've ruined quality of care. They've ruined a lot of things. So what's going on in primary care doctors' offices, they have to see more patients than they used to in order to make the same amount of money. What happens now is it trickles down to the patient. The patient doesn't get as much attention or care from there. Primary care doctors are getting slammed every day. They have to deal with so much bullshit. They got people coming in begging for antibiotics, diabetes, depression, all sorts of stuff. Kids throwing up and sniffling in the waiting room. The last thing that they're equipped with or want to handle is a musculoskeletal injury. During their training in school too, they actually don't get a lot of training in musculoskeletal problems. Last time I looked, their curriculum is about 20 or 30 hours in orthopedic testing and things like that. So when it comes to an injury or a problem, when you're having that, the last place you really want to be is at your primary care doctor's office. They're going to do what they can to try to help you, but usually that's going to be giving you some medication, maybe showing you a stretch or exercise, or referring you out to physical therapy or an orthopedic surgeon. But at the end of the day, you're never going to get a true cause of what's going on or a root cause of the diagnosis of the problem. And it's not their fault. They're just not equipped to handle it. So if you have a musculoskeletal problem, you really need to get to a practitioner that's going to be able to accurately diagnose and fix your problem. I actually had a horror story with one of my patients. Went into his primary care physician for low back pain. Doctor proceeded to tell him that he had a muscle spasm, which I don't disagree on that diagnosis, but it's very vague. Ended up giving him a series of cortisone shots. Was unable to really do any other treatment except give him the cortisone shots. And we all know how I feel about cortisone shots and how bad they really are. But what happened was 3 weeks later, the patient ended up in my office and could barely walk. We ended up ordering an MRI and he ended up having a severe disc injury. I proceeded to call the doctor back and just ask him what happened. And he was dead honest with me and said, you know what, standard of care doesn't allow me to order an MRI until we do some conservative treatment. So as we said, the current medical model is just broken and it's a joke and the patients don't get what they deserve. So if you're having a musculoskeletal complaint, try to get to a doctor that's going to accurately diagnose and hopefully treat the injury. I'm not bashing primary care physicians. Like I said, they're very important, but when it comes to the scope of musculoskeletal injuries, it's probably not the best place for you to start when you're having an injury. So really appreciate everyone taking the time to watch these videos, and please send your comments and questions our way, and we'll be sure to make sure we answer them as quick as we can. And if you like what we're doing and you want to spread the word, share our page and tag people in these videos. Thanks for watching, and we'll see you next week. Thank you.